Hi guys, it's your girl J Poetic and I'm back for another video. Stay tuned for more lifestyle videos, product reviews, and videos on spirituality. I'm not Patti LaBelle, but you should hit that bell. Did you do it yet? Did you do it? Did you do it? Did you do it? Alright guys, let's get into it. Okay, so this video is kind of overdue. I've been procrastinating on doing it simply because I don't know, the idea of talking about all these things kind of makes me anxious. But I promised you guys I would talk about it, and it's probably good to talk about it. It's late at night right now. Also, I'm going to try to, I don't want to get emotional, so I'm going to try to just stick to the facts and give you guys point by point. So if it seems like I'm talking about this kind of like carelessly, or I'm just trying to rush through it, it's because one, it's late, and two, I'm trying not to get emotional. So I just want to tell you guys what's up and move on. Okay, so sorry, let me put some lip gloss on first. My lips are kind of dry. Sorry. That's sticky. Okay, sorry. But yeah, so this video is about my test results. I told you guys I was getting a CAT scan done. So this is about the results for that. But in order to understand my results, you need to go back. So I'm going to go back to a couple years ago just to kind of, so you guys understand like my medical history, if that makes any sense. Okay, so we have to go back to 2016, almost 2017. So 2016, I went to the doctor for a routine checkup, and we were discussing some blood work of mine. We were talking about the fact that I am and was anemic, but at that point in time, I was like very, very anemic, and had really low iron and low red blood cells, but my white blood cell count is fine. Anyway, so my family doctor at the time, who at times is very inappropriate, and even now in present day, he's no longer a practicing physician, so he has many complaints on him, and that's the reason why they kicked him out and he's no longer a doctor. Anyway, I don't want to get into that. The point is that I think he was having a bad day, and I don't know what prompted him to say this, but he was telling me that he thought like I'd never be able to have kids, just based off the fact that I'm anemic. Now, mind you, there are anemic people who have children, and I know that, and I knew that then, but he just like came out and was like, you'll probably never be able to have kids, and you'll probably have to be on iron for the rest of your life and stuff. Really crazy things for your family physician to say to you when you're in a room alone with him. And you know, it's nothing warranted that. So I was about 22. I think I was 22. And so yeah, he told me this, and I was devastated because I've always wanted children. I think I would be a great mother. You know, I've been a great school official, a great daycare worker. I've been a great support worker. I've been a great aunt. I've been a great stepmom. I've been, you know, all of the above, right? So I've always wanted to have children and thought that, you know, I'd be a good mom. So for him to say that out of the blue made me kind of go off the rails a bit in my own life. I should probably tell you that I was going through other things at the same time. Like, I've been an insomniac. I've had insomnia since I was 14 years old. At the time that he told me this, my insomnia was getting really bad. I mean, I was going days and days without sleeping upon end. I was at a career change. I was heartbroken in my life. You know, a little bit after that, my friend had been murdered. It was just like a rough time. So, and I was going through other home issues and so on too. So I like never wanted to be home, was always trying to find a way to like escape and be out and, you know, get in arguments with people and then just like want to forget my woes or whatever. So at that point in time, I was drinking socially. And I started, you know, going out to bars more, drinking a little bit more. I wasn't drinking a lot or, you know, really excessively. Like, I still know people who, like, their Saturday night or Tuesday night, depending on who we're talking about, is way more, like, they could drink me over the table, as they say, or whatever. But nonetheless, I was drinking more for me. Because I was really sad and depressed, not only by that diagnosis years ago, but also just from everything that was going on. Like, my sister, who I've had a tumultuous relationship with for years, had just moved back, and there was tensions and uneasiness there, and you know, I wasn't sure if I was going to get to be around my nephews as much as I wanted to, and an altercation that her and I had years ago was resurfacing again, and so on. So, where a lot of family took her side and then like hated me. So, you know, it was just a lot going on. So I was really depressed, and then on top of it all, I was hearing the fact that I may not be able to have children. So that took me over the edge. Like I said, I wasn't sleeping. I was drinking more. I was trying not to be home. I really had no one at that point in time who I could really talk to, who understood me. You know, even friends who I was sharing the fact that I had at one point in time become suicidal would say things to me like, "Oh, I don't get that. That's dumb. You should just feel different." Or, you know, one friend took me out to try to cheer me up, but ended up ditching me in a bar and like hooking up with some guy or something, and like didn't know that I really, like, I was at a cry for help. Like, I really needed her. I needed someone to talk to, because when you're in that state, it's not that you don't want to talk to people about it. It's that you don't feel safe enough to talk to people about your feelings. And you're giving cries for help because you want someone to tell you no. You want someone to stop you from what you're trying to do, or the voices in your head. And I don't mean actual voices, like I was hearing voices tell me things, but I mean, well, I guess it's all the same. But anyway, you know, I just mean like from what you're feeling about, you know, wanting to harm yourself or not feeling like you can go on or what have you. So it's like, yeah. And then, you know, family, the same thing. So it was just a really rough time for me. I was wrestling with a lot. Yes, wrestling with a lot of demons. And anyway, going off on a tangent. So anyway, I was in a bar. I met someone. We started up a little romance, or whatever you want to call it. And then I started to feel weird and different in my body. Like, I started like not wanting to eat. I started having food aversions. Like, smells to stuff would just drive me up the wall. My boobs were really sore and tender. Like, my period didn't come for about 2 months, over 2 months. And I was like, what is going on with me? Like, I don't feel right. Like, I knew like something feels different. So of course I took a pregnancy test. It was negative. Okay, so I'm like, okay, well, sometimes that can happen. So I went to the doctor and I got them to test me there, and I called and I was like, you know, what's going on? Or they called me, rather, I should say. And my test was negative. So I'm like, okay, I'm not pregnant. That's good. It must be something else. I'll just let my body do its thing. Maybe my period will eventually come. So my period still didn't come for a while. And it was like, what is going on? My symptoms, nausea and tiredness and food aversions and breast tenderness, everything just started to continue. So I'm like, what the hell is going on? So finally, like, it's been a couple months, like going on 3 months, and I never had my period. So then all of a sudden, oh, let me go back. I was being intimate at one time, and you know, there was a show of blood, so that was kind of strange, but I was like, okay, whatever. And then I had went home, and I was just sitting at my table one time. I don't know if I was on my phone or what I was doing, and I just all of a sudden felt really weird, like really weird. And then I got up and I went to the bathroom, and there was a bunch of blood. And then I just kept continuously bleeding for like 16 days. So then at that point, I went back to the doctor, and this same doctor, guys, he was like, yeah, well, you had a miscarriage. And I was like, what? And he was like, well, yeah, we checked your prolactin, which is a pregnancy hormone, and I thought maybe you had more of that was making your body think that you were pregnant, but it's normal, and this and that. And he was like, yeah, but based off of everything you told us, you were probably pregnant. You probably miscarried or had a chemical pregnancy, or some other big word he used or whatever. And he was like, but either way you put it, you were pregnant but no baby. And he said it so, like, excuse my language, but motherfucking offensively, because I'm already feeling emotional and like like crazy. And then on top of it all, my body, let me tell you guys this. So back in 2017, when this happened, I did stop drinking. I stopped drinking because of the fact that I felt like I was pregnant, even though like but I still wasn't taking care of my body before that point. You know, I was being around people who were smoking and drinking, and I was on vitamins, but on and off, because I wasn't always at home. Like, I was at this other person's house and so on. So like, it was like I was taking care of myself, but I wasn't taking care of myself the way I normally would, or the way I should have. So anyway, like, this same doctor, again, being insensitive, but telling me that I had a miscarriage. So I accepted that, which that brought up a whole other can of worms of emotional baggage. Still does. So whatever, I moved on from that, so to speak. Moved on. So then we'll fast forward to like a year and a half, maybe 2 years later. I think like 2 years later. No, like a year and a half later. And same thing, I just started, sorry guys, my window, I can see a cab going across, so if my eyes keep wandering, that's why. But anyway, so what was I saying? Yes, like a year and a half later, same thing, I start feeling the same way. I'm gaining weight, and I'm not like eating more or any less activity. I was actually trying to like do more activity and eat less and stuff, but I'm still gaining weight. I'm like, what's going on? And food aversions, like I remember I walked into this establishment one day, and I just walked by this woman. She was eating something. I don't know what she was eating, but I just like covered my mouth and ran to the bathroom because I felt for sure I was gonna throw up. Oh, let me mention too, the first time I was pregnant and had a miscarriage, I was throwing up like crazy too. Like, we would go out and come home and I would throw up, or we would get ready to go out and I would throw up. And it became like a little joke or whatever that I was like always throwing up. So like, it's the same symptoms basically started up again a year and a half later. So anyway, yeah, but I just didn't know what was going on. So again, I took a pregnancy test. It was negative, right? And I'm like, okay, well, I don't know what's going on with me, but I'm just like, okay, whatever, my body will even itself out. So again, I was at home. This time I was like laying down, and I felt like pelvic pressure and pains in my stomach, and I was just like, that's weird. So like I was moving around in bed, and then I just felt really weird, and I felt kind of like I had to push, really weird. So I don't know. So then I'm thinking, okay, well, maybe my period's like finally coming, and it's just like a really bad period cramp, and like, you know, maybe that's just what's going on. So then like I went to the bathroom after being like in excruciating pain, and then in the toilet I passed, which was my second miscarriage. So I was further along than I was the first time, which the first time, like I told you, I bled for 16 days, and then went forever with no period, and then was out and about, and then got my period, right? That was the first time. The second time, I was laying at home, and pains in my stomach, got up to the bathroom, and then I saw what looked like could have been no more than like 7 or 8 weeks. But yeah, the second time it was totally apparent to me what happened. Like, there's no way that I could not know, because I could see everything. So this was very emotional, very crazy, and so on. So basically that's that. So then there's more blaming myself. There's more like, okay, well, if I knew, then I could have like been taking better care of myself. And rationally, I know that none of these things are my fault, but your mind plays tricks on you to where you like feel like, okay, well, there's people who like don't live a healthy lifestyle. There's people who like do drugs while they're pregnant, not regularly, but I mean like there's these odd cases, right? Like you'll see in the paper like, oh, local heroin addict or whatever had a healthy baby and was passed on or something. I don't know. But the point is like there's all these things, and I'm like, or the reverse is true too. There's people who you know are bad parents, and you see them or hear about them abusing either physically or emotionally their children, or neglecting their children, or giving their children up for adoption. Not that that's always a bad thing, because it can be a very good thing, but I'm just saying, like, there's all these people who either shouldn't be parents or can't be parents, and you're like, but they are, and so why can't it happen for me, you know? So I went through that kind of thing for a while, and feeling like nobody understood me, feeling like there was no avenue to talk about my feelings, which really there wasn't. You know, if I talked about it with family, they just kind of looked at me. Some of them didn't even believe that I had these miscarriages and so on. Like, that's just something I would make up out of the blue. So I don't know. And then other people who knew it was true just didn't like I would talk about things or how I was feeling and they just wouldn't answer me, or they'd roll their eyes, or they'd, you know, walk off. Like, it's just, and mind you, I was going through these things like alone. Like nobody was with me, nobody was holding me down, nobody was there to comfort me, so to speak, and that was really rough. I'm getting off of it on a tangent. Yeah, I've been talking for 20 minutes. So, anyway, so basically, yeah. And then, okay. So now if we go 2 years ago from right now, the date and time we are right now, it was 2019, around April. And again, the same thing happened. I started feeling all pregnancy symptoms. Period didn't come, and there was some spotting at the beginning, but then it tapered off and it still didn't come. I think I spotted for like 1 or 2 days. It wasn't anything heavy, but then my period didn't come and I just was feeling all these pregnancy symptoms. So I'm like, what is going on with me? So immediately I booked an appointment at the hospital. So I went to the hospital. They said, okay, we're going to give you an ultrasound. I said, okay, great. Then they're like, we really didn't find anything on your ultrasound. They were like, we know you had miscarriages before, but you don't have any scar tissue or anything left that would cause this new bleeding that you're having. And I was like, well, I'm not consistently bleeding. I just missed my period, and then I bled for like 1 day, and then it stopped, and then so on. And then they were like, okay, well, did you lose weight or gain weight or anything like that rapidly? And I was like, no. And they were like, okay, well, you probably had another early onset miscarriage. It's just probably your period went to stop, and then it started but continued on, and then you lost it, or some shit like that, they said. And I was like, okay, but I don't really feel like I'm having a miscarriage. And the reason I said that was because I was having pain in my fallopian tubes. It felt like I was having pain on this side and having pain on this side at the same time. Forgot to mention that, which is another reason why I went to the doctor. And they were like, yeah, well, that's what we think it was. Like, you had another miscarriage and you lost the baby, and that's why you're feeling the pain. And I was like, okay, but I had 2 miscarriages before and it didn't feel like that. Like, this pain, it feels like pain is in each of my fallopian tubes, and it would go from one side and come back, whatever. So they were like, no, you're fine. So I was like, okay. Back and forth from doctor to doctor. One doctor told me he thinks that I had endometriosis, which, by the way, they never checked me for. And I was like, okay, well, how do I get the ball rolling with that? How do you guys check me for it? And he was like, well, I don't think you want to get checked for that, because, you know, we have to put a needle and a camera in your spine or something, and then, like, it's kind of abrasive just to do, and then you might not even have it. And I'm like, oh. And then they sent my ultrasounds back to the doctor who I told you from 2017, who was like, told me that I wouldn't have kids, and then told me insensitively that I was having that I had a miscarriage. And then I went to go see him, and he was like, yeah, they sent me your ultrasounds, but I didn't even look at them. Let that set in. Your family doctor gets sent your test results from another doctor, and he doesn't even look at them, let alone expresses to you that he doesn't even look at them. So he got a mouthful from me that day, where I told him off, rightfully so. And yeah, but everybody was like, you're fine, whatever. So I'm like, okay. Oh, by the way, when I went to the doctor for missing my period and for having the pain in my fallopian tubes, they gave me naproxen. They gave me a shot of naproxen, like, above my butt, which is like the main ingredient that's in Advil and ibuprofen and stuff like that for pain. And then they gave me naproxen pills. The pills like were not helping, and all they were doing was making me sick, so I stopped taking them. And nonetheless, I still had this pain. So as time progresses, I'm still showing all pregnancy symptoms, but more. I'm gaining weight, even though I'm working out, I'm eating healthy, I'm trying to lose weight. I'm very, very, very nauseous, to the point that like I couldn't even go any place or do anything. I became very tired. Like, I have insomnia. It's very hard for me to sleep any time of the day, but I would be like taking naps and stuff like that. My iron also got lower. So I was feeling still like I was pregnant, but everything was negative, nothing was happening, whatever. So this lasted 2 years. During this 2 years, nobody could tell me anything. Nobody would give me a Catscan, which I wanted to have. Nobody would give me another ultrasound. People were talking to me like I was crazy, and just everything, okay? I started looking up things about stealth pregnancy and cryptic pregnancy and all this other stuff, and TTC and all this stuff, right? Then what happened? The pandemic happened. You can't even get into the doctor to see about a nosebleed, let alone about anything serious. So that like furthered things, and doctors weren't listening to me before that anyway. I don't know if it's the fact that I'm young. I don't know if it's the fact that I'm a Black woman. I don't know if it's the fact that I've had miscarriages before, or they think that I'm crying wolf. To be honest, I think it's all of these things. But, you know, where's the respect? You know, you go into the medical field to help people, and, you know, these doctors act like if by giving me a CAT scan test just to test my body and see that everything is right, that it somehow takes away from them. You're not paying for the machine. Taxpayers like me pay for the machines, and so on. It's like you're there to do a job. Be professional and do your job. If there's problems ongoing with people, you know, look into it. Sorry guys, I have water in a cup. But yeah, so then the pandemic happened, everything shut down. You guys know all about that. Then, you know, that delayed everything. Finally, I changed my gynecologist, because the gynecologist I had, not only was she not listening to me about things, but she was kind of a bitch. And she was always like, I felt like she was judging me and like trying to push me to go on birth control, or like just everything. So like I got rid of her. And then I started on with the new gynecologist. This new gynecologist was great, and she was listening to me, and she was like, yeah, you know, I definitely think that you need a CT scan. I think we need to definitely look what's going on underneath. She was like, I will order that for you, and I will also give you, you know, a appointment to the Grace Hospital. So she did that, but it took a whole nother year for me to even get in there. Once I got in there, they were like, we'll send you for a CT scan. So they finally did, which is what I just had done. The results of my CT scan, so now we're in present day. The results of my CT scan was the fact that my appendix has extra liquid in it. Yeah. And they also said that they think that I could be starting early menopause. Premature menopause means that your body goes into menopause, and once you go into menopause, you have to either do hormone therapy to bring back on your period, and once you do those things, a lot of times you still can't have children because your eggs, like something happens to your body that tells your eggs that they're like no good anymore. So you would have to, chances are, if you wanted to get pregnant, it would be slim to none. And if you did manage to get pregnant, like you would have to go through in vitro fertilization or even use somebody else's eggs. I'm not a celebrity. I'm not rich. And you even have to go to like Toronto or Vancouver, other parts of Canada, in order to get those things done. So, or even America in some cases. And it's like, it's crazy. So present day, let me go back a bit. So months after the third time that I had all these symptoms, when I was feeling the pain in my fallopian tubes, and I was having all pregnancy symptoms when I missed my period, and I've been missing my period for months, so spotting here and there, but no period, right? About 20 weeks after that, I started feeling movement in my abdomen. Like I started feeling like something was moving. So in my mind, it was apparent to me that I was pregnant. Now I know people will get on here and they'll say, oh, that's a phantom pregnancy, or that's this, or that's that, or you're crazy, or whatever. No, I know my body. I'm very in tune with my body. Like a lot of times I'll be like, oh, I'm getting strep throat. Go to the doctor. The doctor says, yeah, you have strep throat. I'm like, okay. Or I'll be like, oh, I feel like I have a bladder infection. Doctor, yeah, you have a bladder infection. Yeah, I know. Like, not saying that I regularly get those problems, but what I mean is I'm very in tune with my body. I'm very I eat very healthy. I drink tons of water. I need to start doing more exercise and things, but that's just because like we're in the middle of a lockdown and stuff, and my anxiety's been crazy, so I haven't been wanting to see anybody, but that's like neither here nor there. But in general, I'm a very healthy person, other than all this bullshit that's going on. And yeah, so anyway, nobody could tell me what that was. And now they're trying to tell me that it could be a bowel issue as well, but yet nobody wants to check me for anything of the bowel. Also, I don't have like bowel issues. Like I don't have problems going to the bathroom. I don't have any of that. So for them to say that is like kind of left field. And then if you really believed that, why wouldn't you check for it, right? So bullshit again. So anyway, I was waiting. The last time I was at the doctor, I was waiting in there for literally 2 hours after my appointment was supposed to be in there. I watched the doctor go up and down the hall into everybody's room, talking to everybody, and literally like nobody to come and see me. I might even have a clip of that because I'm pretty sure I took a video of the hospital room. So if I have a clip of that, I'll add it in now or at the end. But yeah, and I watched a video on YouTube of this gynecologist reviewing different people's situations. She reviews like the show I Didn't Know I Was Pregnant. She also reviews like different people's case stories and so on. And there's this girl who she interviewed who's going through a similar thing and has went through early menopause, and again, she had no support or anything from the doctors. She coincidentally is a young Black woman such as myself. Also, I will add is that, like I mentioned in another video, I'm starting to get like gray hair, you know, and the average age to get gray hair is 30. I'm a couple years younger than that, but so it could be normal, but nobody in my family has gotten gray hair this early and so on. So yeah, it's really kind of like daunting and so on, because it's just like one thing after another. And yeah, so the doctor also told me that they want to give me another CAT scan in about 6 months, but I got a letter in the mail recently saying that, you know, I have another CAT scan, but it didn't say the date, which is really weird. It just said the date that it, like, they sent the letter out. What else? Oh yeah, when I did the CAT scan, and you guys will remember this from either the video where I was talking about being nervous for getting the CAT scan, or the video where I took the medicine. I don't know, but it's in, okay, I've been talking for 35 minutes, let me get this done. But it's in, I've mentioned it in one video, but when I went to get my CAT scan, you're supposed to take that nasty ass medicine, and they didn't give me the instructions for the medicine. So I was supposed to make a drink of it the night before, make a drink of it the hour before I went, and then get a drink of it right when I was at the hospital. I thought, based off of the sheet that they did give me, it said an hour before your appointment. So I tried to drink most of it an hour before my appointment. Good thing that I couldn't stomach all of it, because like that could have been harmful on me. But they didn't give me the sheet that said the instructions for it, because when I got there, the doctor was like, oh yeah, well, you would have known that on the instruction to take it the night before. And I was like, I didn't. She was like, you didn't? Why not? And I was like, well, I didn't have a sheet that said the night before. I was like, the sheets that are in the bag are the only ones that you guys gave me. She was like, oh, you know what? Someone must have made up the sheet, made up your bag wrong. Then he missed the instruction sheet. I was like, oh, that's lovely. And she's like, I'm gonna go talk to the radiologist and see if he'll still let you take the test, or if we have to wait and book you in another time. So then the radiologist was just like, well, she drank it an hour before she came, and she's drinking a little bit now, so we'll let her take the test. That's, I think, why they want to they want to test me again in 6 months, to do it the right way and see if they get like a different result. But yeah, it's just, it's crazy. It's a lot. It's stressful. Yeah, this video is all over the place. I know that. And again, my thoughts and everything could be more structured. And I know when I go to edit this, I'll be like, damn, why didn't you say that? Why didn't you say this? Or why did you say that like that? But I am talking about all these things very matter-of-factly, because it just like, it like makes me anxious and upset, kind of, to think about all these things that I'm going through, and also to think about the care that I've had, and that if I had had better doctors or more support, that maybe I wouldn't be going through these struggles. And with the whole possibly going through early menopause thing, it worries me, because what if I am menopausal? What if I can't have children, you know? That's something that has been weighing heavily on my mind and my heart. And again, people don't seem to understand. And it's always the people that say, don't worry about it, who don't understand what that means to you, or what it can mean for your life. And my answer to that is always, that's easy for you to say. You already have children. And even people that don't, usually it's people who don't want children. Whether or not I can or not have children, my fertility has been a problem. Yeah, and I don't know if there's something with my HCG levels that when I do end up pregnant, like it just doesn't show in my blood or in my urine or something, like the first 2 miscarriages that I've had. But I have heard similar horror stories, like on YouTube. Like I watched a video of this girl who the same thing happened. Like she felt pregnant, she went to the doctor, they told her she wasn't pregnant because her urine didn't show any HCG in it, any extra HCG I should say. And then it turned out she was pregnant because it only came out in her blood. And there was another girl that they said wasn't pregnant, and then like it turned out that she was, and the doctor thought she was lying because they tested her and then tested her 2 days later and then she was, or whatever. So I don't know any of that. The girl that I was talking about the video, who is premenopausal and so on, like I said, there's a gynecologist going over her case and talking about it. So I will put that in the description bar below, and you guys should watch that because it's pretty similar to my story, and it's also pretty interesting to hear not only her feelings but also what the gynecologist said about her case. And yeah, so I've been going through that, and I've been going through a lot of things. I've cut a lot of toxic things out of my life. I haven't drank for over 2 years, so that's a big accomplishment. You guys will see me on here drinking and reviewing non-alcoholic wine and non-alcoholic beers, and that's why, because I haven't drank for over 2 years, like 2 years and a couple months. But yeah, so yeah, I've also cut like a lot of negative people out of my life, like friends and family and people like I really do keep to myself. Part of that is how anxious that I've become. I don't really like going many places. I only like going certain places that I deem safe. And I only like, and this isn't a COVID thing, this is just like a trauma thing from certain things that I've been through for years, as well as like certain things that I've been through recently and certain people that I try not to run into and stuff. So, but anyway, long story short is that I keep to myself. Protecting my energy now is the most important thing to me. I don't argue with people like I used to. And yeah, just always, I'm a fan of protecting your energy. I preach that to you guys all the time. If something or someone or a situation or a place is not good for you, then do your best to minimize, exposure to that. Take care of yourself emotionally and physically. Make sure you're always checking in with yourself. Make sure you're aware about the products and stuff that you use. I know I review a lot of products on here, and I'm always talking about, perfume and body spray and body wash and lotion and this and that, and hair care products. And yeah, but the truth of the matter is, within the last year and a half, I've slowed down on using certain things. So my skincare routine has no harmful ingredients in it. Maybe I'll share that with you guys soon. And as well as I don't use lotions and so on that have harmful ingredients in them. A lot of the perfumey lotions and stuff I don't use, or I give away, or when I do use them, I use them on my clothes and so on. I'll put a cocoa butter, a real cocoa butter, or a baby oil, or a almond oil, or something like that on my skin, and then I'll use my perfumey lotion on my clothes, and then I'll spray my scent on my clothes as well to make my scent last longer, instead of putting harmful lotion on my skin, because even some of the lotions that you go to the drugstore and get that we've all been using for years have harmful ingredients in them, like EDT or EDM or hexylene or ethylene or triglycerides or sodium lauryl sulfate or anything like that, right? And this isn't cap. You guys can go watch my first video that I posted about 5 or 6 months ago and watch the rest of my videos, and you'll see that I've mentioned this before, so this isn't cap. But yeah, so protect your energy, protect your body. All these things play a part in our health and our mind and our safety. And yeah, two, I'll say this. I've been talking for 44 minutes, so I know nobody's gonna watch this far. but if you do, shout out to you. You're the real MVP. But yeah, so basically, oh, like I have this is my fault. I have problems reaching out to people too. Even people who I don't completely want to shut out of my life. Like my best friend of 20 plus years. I think like we've been friends for like 21 years now. I love her to death and she loves me. And we've both been going through some hard times and so on. And she's a nurse and she's really busy. And I'm really busy, you know, working at the school and now creating YouTube videos for you guys and helping raise my nephews and just everything. And all the emotional things that I've been going through. You know, everybody has their shit. So it's like hard for us to get together, especially with COVID and everything. And I'm not the best at reaching out to people because when I'm going through, you guys know I'm a very sensitive, empathic person, right? Like I can peep your energy at the door. It's another reason I don't like being around a lot of people because it gets overwhelming at times because I feel so much in different environments. But long story short is that I'm such a healer type personality. Like I listen to people, I help them, I give them advice and so on. So one, it's hard for me to ask for those things in return. And two, I take other people's problems on as my own. That's why when I'm in a stressful place, I kind of exclude myself from other people because I can't deal with my stuff if I'm going to be consumed with your stuff, if that makes any sense. And so I'm terrible now for reaching out, and it's not because I don't love people. Like I said, my best friend, 21 years. If you're watching this, I love you, girl. My friend Carol, who like used to live here, I was friends with her son. Then she moved back to Maine in the States. You know, we've been having trouble communicating over email. I've been trying to communicate with her though. But still, like, I don't reach out as much as I should to people because I'm very, like, trying to make sure I'm okay, and I worry about people, too. Even, like, work friends and so on, like, I know they're going through it now that our work is shut down, and, like, I'm trying my best to reach out to them, but still it gets hard, and so on, like, there's people too that I've met on YouTube who I would deem YouTube friends, but then it's like they kind of act funny and stuff. Like if you don't talk to them because you're going through something, then they start like not answering you, or they start like acting like you feel like you're better than them or something, and it's really weird. Or like you might post about like you're feeling anxious and you're having an anxiety moment, and then 2 seconds later they post a video about anxiety but like won't answer you when you message them in their inbox, or like when they go to like message you in any way, it's always about something negative, like you didn't do this, or you don't do that, or your content is lacking this or something. And it's like I am someone who peeps energy at the door. I'm always going to be nice, polite, you know, unless somebody comes at me wrong. But I don't fight about things anymore. Like I don't care to do that with anyone. Not with family, not with friends, not with lovers, not with associates. That's another thing. I've been going through a lot of shit when I was at work, and a lot of discrimination and so on. Like I just don't have the energy to deal with those things. Like I'm trying to de-stress. That's one of my biggest problems too, is okay, this video is 50 minutes. I need to bring down my stress level. That is one contributing factor to everything that I know is like on me. I need to bring down my stress level, and stressing about like these things that aren't important is not what I need to be doing. I need to fix my sleeping habits, and I need to de-stress, and that's what's most important to me at this time. If you guys made it this far, then thank you for listening to my story. If it's all over the place, I know. Love, peace, and happiness to all of you, and I hope you send it back to me.